Hi everyone, I'm GREYMOND. Today I wanted to talk to you about other different mental conditions that you can have in addition to having OCD. This is a question I get asked a lot, and I just wanted to go over some of this with you. So, as you know, I've been doing this for quite a while. I've been talking to people for the last 10 years. I don't really take weekends, although I should, but I talk to a lot of people. I have a lot of data, and this is the data that I share with you. So when it comes to having other mental health conditions besides OCD, in terms of how many people I see with it versus not, I would say maybe 20% of all of my clients have something else, and 80% do not. If not 90-10, you know. So it's not common. Now, when you have OCD, especially if you had OCD for a while, but not necessarily even, you feel depersonalized. You feel very up and down. So if you're having a good day, you might be very happy, normal, and then you have a bad day, and then it's really really bad, and that might seem to an untrained person who doesn't know much about OCD, like if a therapist has not or doctor has not come across too many people with OCD, it might seem like, oh, this is kind of seems like a bipolar thing. It is not. It is just a person dealing with OCD. They had a good day, they had a bad day. The person with OCD might feel depressed because they are in this condition. Well, it's a bad condition to be in. So anybody would be depressed being in this condition. You just have to keep fighting, and you have to keep pushing forward with doing ERP work. You will recover. When you recover, you will not feel bad about being depressed or being in a depressing situation, because you will not be in a depressing situation. So the depression lifts. So this is not, I also have depression. No, I'm depressed because I'm in a depressing situation, and when I recover, I will not be in a depressing situation, and I will not be depressed, right? You can say, well, I feel anxious about everything. Well, there's two things here. First of all, people with OCD, from the very beginning, from when they were very young, they tend to be very sensitive, very anxious, even as kids, you know? So it's somewhat a personality trait that later creates the gateway for OCD, you know? Or you can say that OCD was just developing from childhood. We really don't know which one, and it depends on the case, but it's a combination of the two. Anyways, OCD is an anxiety disorder. Can you have heightened levels of anxiety? Absolutely. What you need to do is you just need to do ERP, just like you're doing for outrageous OCD thoughts. You're doing ERP. You can do ERP for everyday life stuff. Somebody said something bad to you, some sort of an argument, an unpredictable situation. Disregarding, not reacting, reacting to what you need to react because it's real life stuff, but not overreacting, choosing to not overreact, choosing not to ruminate over the situation, ruminate over what you said, ruminate over what's going to happen in the future. You know what I mean? Like those kinds of things. So working on generally how you handle life with the use of ERP after you recover from OCD. So that's something I do recommend, because like I said, people with OCD tend to generally be anxious people. Now, a lot of the times, if a person is in the middle of rumination and they're trying to figure something out in the OCD, which they shouldn't be, but they are, right? They can get very angry if somebody's trying to talk to them and they interrupt their train of thought. Now, this doesn't mean you now have anger problems. It's just that, first of all, you're doing something you're not supposed to be doing, which is you shouldn't be ruminating. You shouldn't be trying to solve the thoughts. But when you are pushed to the limit and your nerves are at max, you can have feelings of anger. That is, again, normal for a person dealing with OCD, and it's a very common symptom. It will resolve itself once you overcome OCD. So you have to look at all of these things as additional symptoms, and not a separate problem that needs, decades of therapy or something like that, and, different medications that are combined with there's OCD medication, this is my depression medication, this is my, bipolar medication, you know what I mean? Like, because the reason why I say this is because I've actually seen doctors do that, prescribe, different medications for different things, which are just different aspects of OCD. And of course, it doesn't lift anything because the person is not dealing with the actual thoughts, right? They're not doing ERP, because that's the one thing the doctor forgot to mention, or didn't know to mention, rather, right? So just as an aside, I really want you to be your own advocate, and I really want you to say, am I prone to depression throughout my whole life? Am I prone to, say, I don't know, anger issues? Am I prone to this? Am I prone to that? And if you feel like, no, this is brought on by OCD because in the moment I'm just overwhelmed, in one way or another, or I'm, in terms of, this is a little bit different, but worth mentioning here anyways, in terms of physical symptoms, right? The person will say, well, I'm tired all the time. Well, of course you're tired all the time. Your brain is working going a million miles an hour, trying to bring up more thoughts, solve more thoughts. It's processing, double or triple the amount that it would be processing if you didn't have OCD. So yeah, it's a bit tired, So you have to understand what is the root cause of all this. Give your brain enough time to rest, because it is working harder, so it needs more rest. So you need to sleep more, you need to rest more, and do ERP, which will eliminate, for example, anger, right? So every time you get angry, why am I getting angry? Oh, that's right, because I want to ruminate and I can't. I should not be doing that. Or people are pushing on me and I can't be pushed on anymore because I've already had it with OCD. Okay, what do I need to do? I need to do ERP. What is ERP? Disregarding. Disregarding means focusing on real life, being with those same people, focusing on real life. Okay, so they're not annoying me, they are pulling me to do what I actually need to do. So I have no reason to be angry, right? So kind of talking yourself through this situation and looking at, okay, well, what is actually happening here? And solving the actual not solve, solving is not the right word, but understanding that this is just part of OCD. Yeah, I'm depressed. Well, this is a depressing situation. So am I gonna lay in bed and think about how depressed I am, or am I gonna try to at least do something that it won't be as fun as if I didn't have OCD? Obviously, I'll still feel miserable there, but it's better there than here, right? So kind of make those active choices and pushing forward. And again, it still comes down to ERP. You can't recover from OCD without doing ERP. You just can't. There is no way to stop that brain mechanism now that you've taught it that this specific situation, no matter how outrageous, is important. There's no way to stop that mechanism without unteaching it, that this is important. So you have to show it in practical terms that bring on the thought. Okay, you brought on the thought? I don't care. I'm disregarding. Another thought? Nice try. Still nothing. And the brain learns, and as it learns, you start to feel better, and you need to be very strong, you need to be very brave, no matter how real the thought feels, no matter how much you feel like you need to do a compulsion, choose not to. Day after day after day, choose not to. Push through these additional symptoms and move and move forward, and you will see that you will recover. Don't worry about who said what. Like I said to you, I don't really see much of it. I don't see people with severe clinical depression. I see people being depressed because they have OCD, and as they feel better, they feel less depressed, and then when they recover, they're not depressed at all anymore because they're happy that they recovered, right? So it's, these things really do solve themselves, I know a big theme for OCD sufferers is schizophrenia a lot of the times. Well, what if I get schizophrenia? Or what if this is not OCD? What if this is schizophrenia? Or some other mental health issue that just sounds very severe. I don't see it in practice. I just don't. In 10 years, I haven't talked to one person who's actually had schizophrenia in addition to OCD. I've talked to a lot of people who have a theme of that. What if I have schizophrenia? What if I have cancer? What if I have this? What if I have that? Right? Health related themes, but nobody who's actually had it. So it's not common, and you just have to push through and recover. I hope you find my videos helpful. Thank you so much for watching. If you haven't subscribed to this channel, please subscribe. I talk about all things related to OCD recovery. If you would like to do one-on-one recovery program with me, all the information is on youhaveocd.com. Thank you so much for watching. I'll see you tomorrow.